Hello, everyone. This is JVS Socal, Veteran Peer Access Network Supervisory District 5. In today's period of instruction, we'll be going over VA benefits and healthcare.
So my name is Matthew Castillo. I was in the Marine Corps from 2013 to 2017. Currently, I'm a battle buddy with VPAN and SD5, Supervisory District 5. Right now, I'm enrolled at USC, getting my master's in social work. Right now, my short-term goal is to get my master's in social work and to pursue a career in social work. And then my long-term goal would be to get my license in clinical social work and to assist the community, especially the veteran community, as best as I can.
My name is Militaryonesource.mil. I was in the Marine Corps from 2008 to 2012. I'm a squad leader with JVS Socal Veteran Peer Access Network. Currently, my goal is I'm trying to apply to USC to acquire my master's in social work program. Long-term goal is to eventually get my license in clinical studies and to facilitate or direct a program or even open up my own practice to further support and provide accessibility for our veteran community. Disclaimer alert, we are not licensed counselors, clinicians, doctors, mental health experts. Everything we will be discussing about today is going to be based off of living experience, as well as these are going to be some resources that we utilized and compiled into a PowerPoint as well.
The topics we'll be covering today will be the requirements and how to apply for VA healthcare, women veteran health services, mental health services, vet center services, urgent care, veterans age 65 and older, the benefits for them, applying for the disability rating, appealing a disability rating, survivor benefits, and education benefits. Randy will start the first half of the PowerPoint and I will finish with the second half.
So for the first half of the PowerPoint, we'll be starting with eligibility requirements for VA healthcare. Be advised, these include but are not limited to the following. VA has rated you a service-connected disability. You received a Purple Heart. You're a former prisoner of war. You're a combat veteran who separated within the last 5 years from active duty or reserve duty. Eligible for Medicaid benefits. Family income that is below the income threshold. And then lastly, served in Vietnam, Southwest Asia during the Gulf War or Camp Lejeune during specific periods of time. As for Reserve or National Guard, you must have been called to active duty by federal order and completed the full period when you were called or ordered for active duty. Active duty status for training purposes, such as boot camp or drill, does not qualify. And then lastly, not all veterans are eligible for VA healthcare. For more information, work with your battle buddy or your local VPAN office or local VA worker to determine your health care eligibility. Documents needed or required for VA healthcare. So DD-214, page 4, social security numbers, account numbers such as your insurance programs that you're enrolled in, be it Blue Shield, Kaiser, Medicaid, Medicare, etc. VA disability rating decision, if applicable. Now, to apply for VA healthcare, you have three methods to approach. You have the online method by submitting your 1010 Easy form through VA.gov. When you go on VA.gov, you have the option to click on Apply Now for VA healthcare, and then it'll go through the steps on one, the form, as well as submitting it. The second option is through the phone, 1-877-222-8387. And then once you're prompted to press the button, press 1. Lastly, you could print and mail your completed form to Healthcare Eligibility Center in Atlanta, Georgia. Address is down below. Next slide will be VA healthcare for women veterans. Reason why we're highlighting the slide or going over the slide because we understand of the lack of accessibility for our fellow women veteran population. Again, these are going to be benefits and VA healthcare eligibility slash benefits for our women veteran population. Healthcare services that are available to our women veteran population as well. So they include, but not limited to, the following: well-being services such as health and coaching, mind-body therapies, yoga, be it yoga or stress reduction, general health services as well. So primary care to care for acute and chronic conditions, birth control support, as well as family planning and preconception counseling, all the way down to menopause care. There's also specialty care services available for a women veteran population, such as gynecology care, such as infertility counseling or gynecologic cancers. Maternity care services ranging from full maternity care from the first time of the first positive pregnancy with full physical exams, lab tests, and ultrasounds, genetic tests and specialty consultations, followed by first 7 days of newborns care. And then in the case, if needed, further support for breastfeeding as well. Mental health services are also available for our women veteran population. For more information and benefits, eligibility slash information on our women veteran population and what benefits they can access, Benefits.va.gov /persona/veteran-women.asp will be a great resource for more detailed information that our women veteran community can access for VA healthcare. Next slide, we'll be moving into VA mental health support and services. So VA support and treatment for mental health barriers but are not limited to the following: be it post-traumatic stress disorder or PTSD, military sexual trauma or MST, depression, grief, coping tools, substance abuse, and or anxiety. In the case you are a veteran or know of a veteran who is in crisis and is in need of help now, there's a fantastic resource, Veteran Crisis Line, who is open 24 hours a day, 7 days a week, 365 days a year. Their phone number is as follows: 1-800-273-8255. And you can press 1 to talk to someone on the line. Furthermore, you could also text 838-255, and then you'll be connected to the Veteran Crisis Line as well. You could request for someone to call you, call an individual as well that you are, call a veteran individual that you are worried about who is going under crisis. And lastly, there is the online method where you could go on veterancrisisline.net and click chat and have the accessibility to chat with the operator via online. In the case that you yourself as a veteran or you know a veteran who is in need of emergency mental health care, please go directly to your local VA medical center or even your local medical center, and then let them know that you're experiencing or know individual who is experiencing an emergency crisis. It's not limited to your discharge status or enrollment in other VA healthcare. You're eligible for the support to get emergency health care support. Moving forward, for eligibility for VA mental health care, you must be separated recently from uniform service with an honorable discharge, or recently separated combat veteran with the honorable discharge, or separated from uniform service many years ago, or current or former member of the National Guard or Reserves may be eligible. So for more information, more clarifications, contact your local VA or contact the VA number at 877-222-8387, or get with your local VPAN office with a battle buddy who will be able to connect you with a VA rep, and you could find out whether or not you are eligible for benefits. These are some frequently asked questions about mental health support. I myself have questioned this question number 2 a lot. Will using mental health services at the VA put my career at risk? With that being said, medical records are protected by privacy laws. Mental health diagnosis or seeking mental health care does not automatically jeopardize work-related credentials. With that being said, there are some factors that, but not limited to, such as like court-mandated, court-ordered mental health mandate may affect employment. With that being said, for more information, contact your local VA, get with your battle buddy at Veteran Peer Access Network, or even your mental health provider. With that being said, in the case that you are debating on receiving mental health services, a suggestion that comes about is I personally have utilized mental health services. I suggest using support for mental health services because it's the number one thing that is very important. So if you are seeking or on the board to move forward to attempt to acquire, I do highly suggest seeking mental health services. Accessing urgent care. So VA offers eligible veterans urgent care benefits for the treatment of minor injuries and illnesses who are part of the VA's network. For eligibility requirements, you must be enrolled in the VA healthcare system, and you have to have received through the VA or VA facility or community care provider received care from within the past 24 months. In order to access urgent care, utilize your local VA facility locator at va.gov find locations. And then upon arrival, notify the urgent care provider that you would like to use your VA urgent care benefit. And then as well as confirm that they are part of the VA's network. Most frequently asked question is, will I have to pay any fees or co-payments out of pocket? You may be charged a co-payment that is different from other VA medical co-payments, depending on your assigned priority group. If you go to the VA's website and search for priority group chart, it should render the chart and be more descriptive on the priority group. Furthermore, you could go to your local VA, request for a packet on accessing urgent care. They'll provide you a packet with a lot of information to get further clarification. Or in the case that you don't want to go through that, you could even contact your local VPAN office, get with your battle buddy again, and then they'll be able to support you further in acquiring those questions or addressing the confusion, any confusion. Next slide is going to be your Vet Center services. The Vet Center is a community-based counseling center that provide but are not limited to the following for eligible veterans: active duty service members, reserve components, and their families. So they provide social and psychological services, and then professional readjustment counseling. Requirements to access your Vet Center services: you're looking at either served in any combat theater or area of hostility, experienced military sexual trauma, provided direct emergent medical care or mortuary services while serving on active duty to the casualties of war or funeral detail, served as a member of an unmanned aerial vehicle, UAV, that provided direct support to operations in a combat zone or area of hostility.
Benefits for veterans age 65 and older. The veterans 65 and older have the disability pension, which they can get from the VA. For this pension, a veteran must have served one active duty day during a period of war. They did not have to be in country during that period. They just have to be on active duty during that time. They must be total and permanently disabled with the VA service connection. And then they must be below a certain annual income. Another benefit they can get is aid and attendance. Aid and attendance is another pension for veterans 65 and older. If a veteran has or is requiring assistance with daily living tasks such as bathing, eating, dressing. If a veteran is bedridden or confined to their house, then they can request this benefit and they may qualify. Get with these, get with a VSO, a battle buddy, or even get with a VA to see if you qualify for any of these benefits. And please do not wait before it's too late. Be getting your benefits as early as you can before you are confined to your house and it creates more barriers than necessary. Housebound allowance is a pension that is paid for the veterans. Um, it's when a veteran is confined to their house due to their disability. For more information on any of these benefits, please call the VA 411 or 800-698-2411. Again, ask your local battle buddy with VPAN. We can get you with a veteran service officer and we can set you straight on which service or benefit that you may qualify for. Now, for veterans applying for their disability rating or their service connection with the VA, and this is for all veterans, not just 65 and older, some of the documents you should obtain before applying would be your DD-214, your medical record from the military, VA medical records if you're already going to the VA, or any hospital records that you have to show your symptoms or disabilities that have come from the military. Once you're preparing to go to the VA or meet with the VSO, I'm sorry, if you're applying for the first time, make sure that you have all your VA appointments or documents of when you went to the VA and what has been going on. When you're meeting with your doctors, don't minimize your symptoms, disabilities. Don't make it um, don't make it a small thing. Really let them know what's going on so they can help you as much as possible. Go to all your meetings, including the VA Vet Center, any groups, mental health groups that you're going to. All this will help the VA determine whether you're qualified or what percentage you are for disability rating. And again, for any assistance, get with a battle buddy so we can link you with a veteran service officer and we can assist you from there. For the appeals on a disability rating, if a veteran is not happy or does not agree with the decision the VA has made, they can appeal. One thing they can do is a supplemental claim, and that is when the veteran will bring more evidence and the case will be reviewed at a higher level. If the veteran believes the VA made a mistake, it can be reviewed by a senior reviewer. Then the veteran can apply to have the submit or the claim appealed to the board. So the board of veteran appeals can look at it again and determine whether the VA made a mistake. Um, and then again, if you need any assistance, get with the local battle buddy so you can be connected with a VSO. For survivor benefits, for dependents of the veteran, one benefit that they may have access to is the Education Assistance Chapter 35. Dependents that are eligible for Chapter 35 are dependents if the veteran is rated 100% service connected and is total and permanent service connected, the dependents are eligible to use the education benefits. If the veteran was missing in action, if the veteran died due to a service connection disability, was captured in the line of duty, or detained for longer than 90 days, they are eligible for Chapter 35. Children of veterans, they will age out at the age of 26. So it's important that the children of the veterans, as soon as they are able to start going to college and using Chapter 35. Chapter 35 will pay the dependent a stipend of $1,265. Chapter 35 does not pay for tuition. They will only pay the stipend. Another benefit can be used would be the Cal Vets education benefit, and that will actually pay for the tuition. For more information, please contact 800-827-1000. For education benefits for veterans, veterans have the post 9/11 Chapter 33 GI Bill. For the Chapter 33, it's available for all service members who served on or after September 11th, 2001. I believe after, I think it's around 10 or 15 years, the Chapter 33 post 9/11 will actually age out unless you got out in 2014, and then you will have the Chapter 33 forever until you use it all, pretty much. Another education benefit would be the Chapter 31, the readiness and employment. With this, a veteran has to be service connected at least 10%. And then a veteran will get a stipend, just like the Chapter 33. They'll get a monthly housing allowance. Their tuition will be paid, their books will be paid for. And to figure out the housing allowance, it'll be what an E5 with dependents make in the zip code of the school. And that is for both benefits, Chapter 31 and Chapter 33. To find that, you can just Google E5 BAH, and then you should come up to a website that you'll put in a zip code and it'll show you what the BAH is in that zip code. Chapter 31 also pays for a laptop, printer, and a parking pass if the veteran is on-campus student. References we used today was the Veteran Affairs, the VA.gov, Benefits.va.gov, Veteran Affairs Welcome Folder, which we give out in the physical class or period of instruction. If you would like this folder, we have it at the office at the JVS VPAN supervised with District 5. You can also probably Google it and it will pop up. Other references are military.com, vfw.org, and Militaryonesource.mil.
In the case that you have any questions or know any veterans who have any questions, please don't hesitate to reach out to LA County Department of Mental Health Veteran Peer Access Network. Through their website, you could search Veteran Peer Access Network or VPAN, and you should be able to look up the information on there, as well as contact them directly, which will get you connected to your local VPAN office based on your address. With that being said, this concludes our period of instruction. Thank you for your time and take care.